perfect segue for our second segment today, and we'd like to welcome Terry Dunne to the program. Terry is a Senior Vice President and Managing Director of Rollover Solutions Group at Millennium Trust. Good morning, Terry.
Good morning.
Thank you for joining us this morning, and if you could please start off with kind of giving our audience an overview of Millennium Trust Company.
Sure, I'd be happy to. Millennium Trust is a financial services company. We are primarily in the IRA niche space, and realistically our 2 or 3 businesses focus on helping investors with IRA decisions that they make. One business is specific to using IRAs to invest in alternative assets such as hedge funds, limited partnerships, real estate, precious metal, things like that. And the other business, the one I manage, really helps corporations, healthcare corporations and others, when they have a situation where participants in their retirement plan no longer work for the company. And basically the DOL, the government, allows those plans to move those participants into an IRA if they're missing from the plan sponsor. And so we help move those individuals into an IRA and basically reunite them with their money. So that's a little bit of a summary of what we do. We've had a lot of success over really the last 15 years, and it's definitely a growing business. Yeah, for a lot of reasons. There's a lot of money moving into IRAs, and there's a lot of baby boomers that are retiring.
So talking about the healthcare industry in particular, why do you see so many healthcare workers changing employers so frequently, and how does that compare to other industries?
Yeah, I think that's a big factor in today's society, and the healthcare industry really isn't that different from most other industries in that people are only staying employed with one company on average from 3 to 5 years. And a lot of this has to do with employees have many options, many choices. They're looking for advancement in their careers. They're looking for more pay, aren't we all? Looking for better benefits. And really there are a lot of young people, in the healthcare space, a lot of millennials. They're getting married, they're starting families, they're moving around. I would say that millennials often think 5 years at the same company is kind of like forever. And that's really changed in our society, and the healthcare industry is no different. And it is interesting because really the topic that I'm going to talk about today really does hone in on that concept of stress management, and particularly in the financial wellness arena.
And Ron, did you have a question for our guest?
Yeah, Terry. Welcome to the program. It's Ron Bachman here.
Hey, Ron, how are you?
I'm doing terrific. Your last comment really connects the 2 segments. I don't know if you had a chance to listen in much on the earlier segment, but the whole idea of wellness now graduating, if you will, into well-being, more around the whole person issues around stress and management, whether it's work, whether it's personal life, and clearly financial is a big part of stress in most people's lives, and that's where your emphasis is. Let me ask some questions about 2 different segments. First, the individual. Tell our audience a little bit about, as an individual, how you would help them with their IRA and maybe rolling over or self-directed accounts, or how does your services help or affect individuals?
Yeah, sure, absolutely. Well, largely what we want to do is help individuals make sure that they are making appropriate investments, make sure that they are well diversified in their investments. And although we don't give specific investment advice, we work with a lot of advisors that provide that advice to individuals, and then we're the IRA custodian. And so our goal as the IRA custodian is to help individuals have access to the right investment vehicles and then provide them with excellent quality service. We answer the phone, immediately on a timely basis. Our people are well trained, well organized, very helpful in answering questions to our clients as a whole.
I know in your website you sort of have custody is our core, so your core business is holding those IRA assets. I take it from that comment. And could you explain to people in our audience, because this gets into the weeds pretty deeply that you or I or others may be somewhat familiar with. But if you try to roll over an IRA from a company you've worked for and you don't do it properly and you receive those funds, isn't there some big tax consequences that people want to avoid? And is that one of the main things you're trying to help them with as they try to move from company to company and retain the tax advantages of their IRA?
Yeah, absolutely. Basically, that when someone leaves a company, they become somewhat of a burden to the plan that they're already in. Many times that given plan is not going to allow them to stay. Sometimes they will allow them to stay if they have a larger balance. But fortunately, there are alternatives that are very beneficial and allow an individual to continue to get the tax deferral benefits and the benefits of investing in good vehicles. So really the three choices, the better choices, tend to be leave the balance with your former employer. As I said, some employers will allow for this. Second choice would be roll it over into an IRA. And I think this is a great choice to allow yourself really more control over your investments and more choice of investments. There are, stocks, bonds, CDs, money markets, ETFs, alternative investments. It's easier for you to work with an advisor. And most importantly, it's a nice opportunity to consolidate your retirement assets in one place. And the third choice, good choice, would be roll it over into a current 401k plan. So you've left one employer, you go to another employer, and they might allow you to move your money into that plan. And that's also a good choice for consolidating your retirement assets. Not every employer is going to allow that, but those are your three best choices. On the other hand, probably the one choice you don't want to make is where it gets distributed to you in cash. You don't roll it over into an IRA, and therefore you're going to have an income tax consequence on all those assets, and you might have a penalty because you're younger than 59 and a half. So we do help in the communications and our marketing materials and everything else, our educational materials, to help individuals make the right choices and to think it through.
And talk about your corporate, or what some might call your enterprise solution. How are you working directly with companies, and are you providing that sort of educational service through the employer so that you're sort of a backroom a solution provider, but the individual is getting the information as part of their previous employer's services, if you will? How do you work with employers, I guess, is the bottom line?
A little bit of yes and no to that question. So we work regularly with corporations, healthcare and otherwise, I would say a majority of our clients are in the healthcare space. We work with a lot of hospitals and a lot of medical centers. But anyhow, it's really a situation where employees no longer work for a company, continue to participate in the plan, and yet they've likely moved. They no longer are communicating with the company, and therefore the company, in essence, is at risk that they're not properly communicating with people, and that's a requirement of ERISA. So one thing we do is we work with corporations to minimize the chance that they are creating problems for themselves. They send out a letter to those participants. They don't come back because the participants have left. They don't have a good address for them. They roll it over to us at Millennium. We then have search tools to find almost everybody. We find probably about 90% of the participants immediately and, in essence, reunite them with their money. They're often very happy. They had forgotten they had money, and now they have money. And we, encourage them, talk to them about what it is they want to do, and often they leave the money in an IRA, or maybe they roll it into a 401k plan that they're currently working with.
I'll get a few minutes. One last question, I guess. The millennials, I guess, younger people in particular, seem to be in a bind these days. The cash flow just to pay for their family expenses, having children, having a house. Where do you see the future going in terms of people actually being able to set aside money for retirement, which we know is getting more and more expensive because of healthcare issues themselves? But where's the movement of retirement going when people are suspect about the Social Security benefits even being there when they retire?
Great question, and you forgot one important expense that the millennials have that many of the rest of us didn't have to this extent, which is
parents,
college loans. That many of the millennials have big burdens with paying back their college loans, and this has created a big problem for them. But let me just say that Kevin previously in that previous conversation was talking about stress and those kinds of things, and the problem today in our society is that we do have this expectation of living a long time, that longevity because of, health care, because of better medicines, because of better lifestyles, whatever it might be, people are living maybe 10 or 15 years longer than what they had expected was possible. And yet in today's workforce, people are saving not enough. And so the concept of retiring at 65 has gotten very difficult, and because most people won't have the resources that you work until you're 65, and you might be alive for another 30 years. So, that's a big issue, particularly in light of the fact that, healthcare costs and many other costs, housing costs, will continue to grow to be very substantial. So we at Millennium really spend a lot of time trying to figure out, ideas and things that people can do to improve their situation. There is going to be a retirement crisis for many people, but if individuals take the time and do some research, figure out, what their cash flow situations are, work with advisors, they can improve their situation, they can minimize their stress, but they have to, basically start early if they have that possibility.
Great information. We always run out of time when we're getting into these great discussions about topics like this. You want to give some quick takeaways in the last 60 seconds that we have, and then how can people best get in touch with you?
Yeah. So takeaways, I would say that, that advisors are there to help. The government is trying to do things that can help in this, potential retirement crisis. There are a lot of good tools that are available, like IRAs, roll-ins to new retirement, new 401k programs. People are going to continue to switch jobs, and they just have to plan and take responsibility for what it is they're trying to do, and maybe they can minimize sort of that crisis or that stress for themselves. And if people are interested in more information, we have, white papers and a variety of information ready and available on our website. My phone number is 630-368-5675, and our website is mtrustcompany.com.
Very good. We appreciate it, Terry. Great discussion, great information, and look forward to seeing you in Atlanta.